Good morning. This is the voiceover PowerPoint for NU 1112. We will be talking about the cultural assessment, cultural competence. Let's review our student learning outcomes. Number one, identify the importance of cultural consideration in shaping nursing care. Number two, demonstrate awareness of one's own cultural beliefs. Number three, demonstrate awareness of one's own stereotypes and one's prejudice toward those who are different from self. Number four, list ways to modify healthcare delivery to be more congruent with cultural background. Now, in our area we live in, there's some diversity of culture, but if you ever end up living in a large metropolitan area, such as I did in Houston, Texas for 10 years, it is quite different. And so you may run into these issues with cultural, ethical, and spiritual considerations. These are important pieces of patient care because they affect the patient, and your care will need to be aligned with that as much as possible. Culturally competent care here, it says, is delivered when the nurse values health or illness experiences through the patient's eyes. You put yourself in that person's place, so to speak. Not undifferent from empathy. So talking about nurses from different backgrounds or cultures may practice in different ways. That's very, very true. I've worked with nurses who were trained in the UK. I've worked with nurses who were trained in the Philippines. I've worked with nurses who were trained in other different countries, and they are different, and they have a different philosophy, and they have a different way of doing things, and sometimes they may have some issues with going over their own values or working outside their culture. So it takes a lot of give and take. It takes a lot of understanding, and it takes a lot of making sure what we are doing is meeting the patient's needs. And you see here an example. Native Americans, I've not worked with very many Native Americans. I've worked with a lot of Hispanic people, like I said, other parts of the country, but here's just an example of how the Native American, or Native Indian rather, person might practice nursing. And so when we're talking about spiritual or culture, it's not necessarily restricted to race or ethnicity. It's primarily learned within the family unit or a generation. And so a lot of things are passed down, so to speak, from one person in the family to another, or from one generation to another. And they may or may not be grounded in science, but we need to understand where the components of all of this, and if possible, educate on what is grounded in science and what is not. You're not responsible for knowing the health beliefs, practices, and values of all groups. That would be impossible. But you are responsible for asking about those beliefs because this helps you deliver better individualized care. Every patient is different. You may have 4 patients and 2 of them have a diagnosis of diabetes, but they are very, very different. Their needs are going to be different. Their knowledge level is going to be different. You may have someone who comes into your facility wherever you're working and they have a charm or something around their neck, and they often touch it or feel of it, and the thing you need to do then is ask, what is that, and how is it significant to you? Even if you don't understand it or you don't necessarily believe in it, that patient does. So you're asking these things. Culture and ethnicity and religion sometimes tend to overlap, but again, we want to ask about unique beliefs, practices, and values. Another story I can tell is I took care of a patient one time who was a very devout Mormon, had actually been to the big temple in Salt Lake City and had been, quote unquote, anointed. And there were special undergarments that this lady had to wear. And the thing about the undergarments, and they weren't like anything you would ordinarily think about as far as underwear. They were very different, made out of different material. But the bad thing about this was this lady was told never to take off this underwear, not even to wash it. So you can imagine the issues that could arise with that. But we did our best to work around that. And we did try to clean the material as best we could. But it was something that we did not understand and maybe we did not agree with. But we made allowances so that this patient's beliefs and her faith was left intact, and she valued our efforts to accommodate her. Culture versus ethnicity, slight differences. Culture is all the socially transmitted behavioral patterns, acts, beliefs, knowledge, values, etc., that influence a world view. Whereas ethnicity is a social group within a cultural and social system, and they share common cultural and social heritage that includes language, history, lifestyle, religion, or all of these. So there's just a slight difference. The culture is more of a worldwide view, whereas the ethnicity is maybe a group within a group that has special, has different ideas and different beliefs. Religion and spirituality are not the same thing. Religion refers to an organized system of beliefs, rituals, practices in which an individual participates. And then spirituality, as you see here, encompasses a much broader area. It can include prayer to the person that they worship in the religion or to other things, meditation. People get in touch with themselves with walking and being in solitude and listening to music, and there's all kinds of ways that they can get in touch with themselves, with nature, whatever their spiritual belief is. And these things do influence interpersonal behaviors and expectations. And so someone like myself, I have a very strong faith in God. And then I meet someone who believes that they can get in touch with God in the woods. We may have a little interpersonal behavior issue, possibly, where we just may not understand one another. And that's where that dialogue, that conversation is very, very important, and asking about those things. For spirituality focuses more on the self than a deity. So that's just another way of thinking about it. Now, there's something called the importance of culturally and linguistically appropriate care. It's an organization or a body, if you will, that has national standards, 14 of them, to ensure equitable and effective treatment of all patients. And these standards are organized around these themes, and I'm not going to ask you about these on an exam, but they are something interesting to talk about. Culturally competent care, language access services, which is often difficult maybe in a rural area like this, and there's organized support for cultural competence. So the organization provides their employees or whoever with the means to learn cultural competent care. Now the nurse must understand our own cultural beliefs. We have to understand that our own cultural values, beliefs, attitudes, and practices about health and illness. We have to understand that about ourselves before we can really be culturally competent. We have to find out where we are coming from. One of the standards that we were talking about here states, and I quote, "Healthcare organizations should ensure that patients receive from all staff effective, understandable, and respectful care that is provided in a manner compatible with their cultural health beliefs and practices and preferred language." So you can see how these three components are addressed in this statement. And in order to define effective care is there positive outcomes and is the patient satisfied? And there's a big emphasis on patient satisfaction, and you'll be hearing more about that as you go through the program. Respectful care, the values of the patients and preferences and expressed needs are considered. They are valued. They are asked about. Cultural and linguistic competence. And so that really means that we try to work within the healthcare, the beliefs and values of the patient, as long as they are not detrimental to their treatment and care, or they are not repugnant, if you will, to the staff. We have to work around some things sometimes. But in my experience, most patients that I have dealt with, and even other staff members who have been of a different ethnicity than my own, cultural beliefs, religious beliefs other than my own, most of the time if you have a conversation, and sometimes you have to agree to disagree, but you do it amicably and professionally. And in the language piece, oftentimes, if you don't, you need to really use a trained in healthcare and trained interpreter. Family members are not always the best because they don't really understand the medical piece of it. So if at all possible, use a medically trained or healthcare trained interpreter. I know at one facility where I worked, we did not have interpreters. This was in Northeast Missouri, and we did not have. So we had this language line, a special phone that was hooked up to somewhere, I'm not sure, but you could access many languages through this language line. And so at that particular facility, we had a lot of, I can't remember the name of the people, but they were from the continent of Africa. And they spoke a dialect of French that was very unusual. And so we dialed up the language line, and I would speak to the person on the other end and tell them what I wanted to say to my patient. And then I would hand the phone to the patient, and that interpreter on the other end of the line would tell her, and I'm particularly talking about a woman who just had her baby, and I'm giving her well baby instructions. And she would listen, and then she would respond to the interpreter, hand the phone back to me, and the interpreter would tell me what she said. So you can see it would take some time, and sometimes you can use picture boards or other things to communicate. I wouldn't necessarily rely on gestures, because sometimes gestures can be misunderstood by some cultures, and you could come across as being very inappropriate and profane. So a trained interpreter is best, or whatever you might have available. Legal considerations, and we're talking about these standards again. Standard 1, we just said this, that patients receive effective, understandable, and respectful care, compatible with cultural health beliefs and practices and preferred language. The Joint Commission is another organization. The Joint Commission for Accreditation of Hospital Organizations, also known as JCO, requires that a spiritual history be taken from every patient admitted to the hospital. And so when you get to clinical, or when you started getting more into your documentation for clinical, there may be a space for you to look at and address for spiritual assessment. Let's see. So in addition to all of this, culturally sensitive nurses possess basic knowledge of and constructive attitudes toward diverse cultural populations. In other words, we're aware, we know it exists, and we maybe not agree with it, but we tolerate it, I suppose, is not a very good word, but that's kind of what it is. And then culturally appropriate, as we apply the underlying background knowledge that we have to give the best possible health care, nursing care. Respect for others and yourself. Realize you have to know your heritage and yourself and your patient. Examine the patient within cultural context. There are some cultures that a male nurse would never be assigned to care for a female patient. Even female nurses with female patients, they are not allowed to view the body without some sort of covering and that sort of thing. Ask simple questions, speak slowly, pace the questions. You don't want to bombard them with too much. Try to get the patient engaged as much as you can. Make sure that they understand either by way of interpreter or something like that. And then, of course, sometimes touch is appropriate and sometimes it isn't. So as you learn more about the people, the cultures, and so forth that live in your area that you practice in, you will learn all of this. We just went through this. We have to be careful of our own biases, and we do have them, even if we may not be aware of them. So, you know, some people are biased and have a preconceived idea about certain cultures and religions and races and so forth. Be aware of your own and don't let that come into your care. Do not stereotype. Recognize the uniqueness of every individual. That includes anybody, of course. We treat all patients with respect, regardless of their station in life, whether they are a famous NBA basketball player or they're a homeless person from the street. We treat both of them exactly the same with respect and dignity. Cultural heritage equals their roots, okay, our roots. This helps explain sometimes their activities and beliefs. Where did they come from? How were they brought up? What kind of family unit and so forth? And of course, within different cultures and groups, we already said there might be some different things that happen. We have a lot of misinformation about some things. So each person, each patient deserves individualized assessment of their culture and their religion and all those things that we've just been talking about. So here are just some personal and psychosocial type questions that you might be prompted to ask. Again, remember, a lot of your electronic healthcare records will supply you with a list of things that you can ask, and you would check a box. So you don't necessarily have to memorize each one of these, but you can see a lot of them are just common sense. Some people, when we're talking about their current health problem, some people believe that it's a curse or they've sinned and God is mad at them or whatever. There's a lot of things, and you just need to find that out. You're not there to fix the problem or change their mind. You just need to figure out where they're coming from and how you can intervene to give the best patient care that you can. Also know where it says the patient's surroundings. Are there any significant religious symbols? It could be, for your Catholic, it could be their prayer beads, it could be their crucifix. It just could be any number of things that means a lot to that patient, and whenever possible, we accommodate them and let them have those things with them. Now, sometimes they'll want to wear things to the operating room that we cannot allow them to do, and so we kind of make a contract with them. Hey, you're watching us. We're going to put it in this envelope. We're going to seal it. You're going to sign it. I'm going to sign it. We're going to put it in the safe, and as soon as we feel like it's appropriate for your care, we will bring it out and let you have it back. So those are things you can do sometimes to address any things along that line. Lastly, be sensitive. Be aware of your body language. Be aware of your facial expressions. Be aware of the tone of your voice, because those are all nonverbal communication. And we already know that people tend to believe nonverbal over verbal communication. Ask questions. Be appropriate in your wording. You never want to use street slang. You know, how you would talk to your homie or whoever. Try to get some specific information. Do not stereotype. Do not assume care for one individual of a culture is appropriate for another individual of that same or similar culture. Remember, we're all individuals. And regardless of culture or race, each patient is unique. Take time to know each patient. Take time to know each patient.